Hello and welcome everyone. Thank you for joining today's presentation from the Health Connector, where we share information about the Health Connector and resources available for those who need health insurance coverage. You have joined the presentation, Shop and Enroll in Health Insurance through the Health Connector. As people join, we will get started at noontime today as scheduled. My name is Erin Ryan, and I'm from the Massachusetts Health Connector. I'm joined by my colleagues Nikki Conti and Melissa Montrand, who will be presenting today's information. Together, we are here today to share information about getting insurance coverage through the Health Connector and to help answer any questions you might have. We'd like to take a moment to thank our community partner organizations and elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, just some information about our presentation format. Everyone's audio has been muted and video has been turned off. The presentation portion will last approximately 30 minutes, then we will have time for a question and answer period. If you would like to ask a question at any time, please use the Q&A button at the bottom of your screen. We will be monitoring your questions throughout. Please do not share any personal information or private health information when you ask your question, as others on the call are able to see your questions. If you have a personal scenario that you would like to discuss with someone, we'll be providing contact information for the Health Connector's Customer Service Center and instructions on how to find local help from a navigator. We are recording today's webinar. Following today's session, you will receive an email with the presentation, so there's no need to take detailed notes. At the end of today's session, you will see 3 questions on your screen. Please complete these questions as they will help us improve our future webinars. So without further ado, I will pass it over to Nikki and Melissa. Thank you.
Thanks so much, Erin, and thank you folks for either joining or viewing this recording today. So as Erin said, Melissa and I are here to share some information with you about the Health Connector. We'll also have a special focus today on premium paying. So for those of you who are watching this live, it is December and we're getting close to the payment deadline for January 1 coverage. And for those of you who are watching the recording, we hope you find this information helpful whenever you're viewing this. So with that, I am going to begin the presentation and just talk a little bit about what we're going to cover today. So if you are less familiar with the Health Connector, I'm going to quickly cover who we are and what our open enrollment period is. And then if you are currently a member, we'll talk a little bit about what you need to do, what's new about 2023 coverage, how do you compare plan options, and then, as I mentioned, there'll be a special focus on ways to make your payments, and I'll be providing some information about auto pay, as well as just getting help with any one of these processes. My colleague, Melissa Montrand, is going to do some live demonstrations for you so she can show you a variety of tools that are available on our website to help you shop, as well as showing you how to make a payment through the guest portal. So I'm going to continue on and just talk a little bit about the Health Connector's open enrollment. So for those of you who don't know, the Health Connector is the Massachusetts health insurance marketplace, and we're here to offer coverage for individuals, families, and small business owners. For people who do not get access to health insurance through their job or through a spouse or partner's position, this is the place for you. A lot of people who apply do get help paying for their coverage. And it's important to note that people can also buy dental coverage in addition to health insurance. Now, when I mention small employers, I want to just caveat that and explain that we are here, or Health Connector for Business is here, for employers with 50 or fewer full-time employees. If anyone is interested in a Health Connector for Business plan, you can go to our website, mahealthconnector.org/business, and you can get more detailed information about those offerings. So open and closed enrollment. So what does this mean? So right now we are in an open enrollment period. So as I mentioned, this is early to mid-December. And during this time, people can apply for new coverage for the coming year, and members can actually shop and compare their options for 2023. Now, during open enrollment, which began on November 1st, people don't need to have any particular reason or an event to qualify to sign up for coverage or change coverage. This is kind of the open season. We do tell people that because all Health Connector plans, whether it's health or dental, because they start on the first day of the month after somebody enrolls, we do encourage people to just apply right away. See if you have, see if you can get your coverage for the first of the following month, or because we share a system with our partner organization, Mass Health, some people do qualify for Mass Health benefits, which begin a little bit sooner than the first day of the following month. Now, special enrollment periods, I just want to explain this a little bit. So when you are outside, or when we are outside of open enrollment, basically in order to be able to access health insurance coverage, someone needs a qualifying life event. So what are these things? These are life events that essentially are opportunities to get into coverage. So for example, if you lost coverage through an employer, if there were changes in your household, so for example, if your income went up or it went down, or if you moved, even moving within Massachusetts could give you a qualifying life event. Because if you're moving from one part of Mass to another, you may no longer have access to that health insurance carrier or that network that you need. As you can see, there are other life changes. We have a complete comprehensive list of special enrollment period qualifying life events on our website. But important takeaways are, if you do have one of these events and you need health insurance coverage, you should report that or come in within 30 days of that event. And then you will have 60 days from the date of that event to enroll and select a new plan. Now, during a special enrollment period, any payment or enrollment deadlines still apply. So you do still need to be mindful of those rules. So as a new member during open enrollment, what do you need to do? So we, during open enrollment or in advance of open enrollment, the Health Connector runs a number of processes to help a person renew into their health insurance plan. So we follow guidelines to make that happen. So if anyone is eligible or they're enrolled in a health insurance plan through us, and they continue to be eligible for that coverage on January 1, we're going to automatically renew people into a plan. Now, as I mentioned, during open enrollment, during this time, if you are a Health Connector member, you can shop for and you can select a different plan. You do not need to stay with the current plan that you are in if you don't want to be renewed into that next year. On the right-hand side of the screen, you are seeing a copy of one of our eligibility notices that talks more about open enrollment, specifically what you need to do and important dates and deadlines. So again, for members who are watching this, please, look at your mail, open it up. There's some really critical information in there for you. And one of the notices that you would receive from us is going to include the name of your plan, the pricing of your plan, really key information that you're going to want to be aware of in case you want to make any changes. During this time, we also reach out quite a bit, and there are a couple of different methods that we use. We'll be reaching out to members via notices, similar like one you saw before. We'll also be sending emails to members, as well as using robocalls. Now, really important, if you are a Health Connector member, you can go to your member portal and you can download and print any notice that we sent to you. So, this is real, it happens. You may lose track of the notice. You're not sure where, you saw it. You're not sure where you put it. Don't worry. There is a copy of all those notices available for you in your member portal. Now, one other way we reach out to you, one other way we communicate with you that's not listed here is over text message. And we only do that if you give us permission to do that. So as members call customer service, they may select or opt in to receive text messages from the Health Connector. So it's not included here. And again, it's only if you opt in for text messages from us. Now, what are some of the important messages that we have been sending out to people? It's really been about, in addition to open enrollment, it's really been about keeping income and your application up to date, particularly if your employment situation changes. By keeping this information as accurate as possible, it helps to make sure that you get the right amount of help, paying for your health and dental insurance, and if you're getting advanced premium tax credits, we want to be sure that you have a lower risk of owing dollars to the IRS when you file your taxes next year. Something important to note about these advanced premium tax credits that reduce the cost of monthly premiums. If you are someone perhaps who you're seasonally employed, or you have a couple of different jobs, and as you're thinking about the tax credit that you're eligible for, you might say, my income fluctuates throughout the year. Perhaps I get a $500 tax credit. Maybe you want to adjust that amount and take a lower amount. And it's also important to note that if you did take a lower amount, at the end of the year, when you file your taxes, you may also get some dollars back from the IRS. Now, on this slide, when you get these the slide presentation, you will have links. You will see these links. These are active links, and you can go to review these pages on our website. So we have a page on updating your income, etc. So we just want to make sure that you have quick access to this important information. Now, thinking about 2023 coverage, what is new? So there were a few changes this year that, depending on where you lived, you may have received one of these letters from us. So there were some brand changes, so name changes for some of the health insurance plans. So Always Health Partners is now known as Mass General Brigham. Boston Medical Center Health Net Plan is now WellSense Health Plan. And then in addition to some name changing, we also had a couple of changes to in the service areas and plans. So for folks who live in Worcester County, beginning in 2023, Health New England is no longer going to be available to Connector Care members. So what will happen there is people in that area who were Connector Care members enrolled in Health New England are going to be moved into a new plan, whichever is the lowest cost Connector Care plan available for them in that area. Now, if I'm talking to you, you live in that area, you do not need to stay in that new plan that we've enrolled you into. You can certainly shop and change plans for January 1st. Now, similarly, for those folks who are currently Tufts Premier Health Plan members, so anyone who's not getting any help paying for their premium, but instead enrolled in a Tufts Premier Health Plan, they will no longer be offering health plans through the Health Connector. So folks who were in those plans are going to be enrolled in a similar plan through Harvard Pilgrim Healthcare in 2023. If a person who is now enrolled in Harvard Pilgrim no longer wants to be in that plan, you would want to make those changes. They would want to make those changes during open enrollment so that they take effect for January 1. A few other things to be aware of as you're going through our website, shopping for plans, new things you may see. We now have a quality rating system available on display. And so you can look at each of the health insurance carriers and see different, you can see ratings for different categories. So for example, there's an overall rating that is made up of member experience, plan administration, medical care, etc. Now, this star rating system, as you can see indicated on the slide here, this really isn't a complete picture of the services or, everyone's experience of that healthcare plan, but this is information that can help inform you, inform your decision if you are choosing between two health insurance carriers. Now, really positive for Connector Care members in 2023. In this plan will now include $0 cost sharing for certain medications associated with diabetes, asthma, hypertension, and coronary artery disease. Also, Connector Care plans in 2023 now have the $0 cost sharing for PCP sick visits and outpatient mental health visits. Now, there's a note here that members should always check with their carrier that their doctor's appointments, visits, etc., are covered, or if they're not sure about their prescription, etc., just double check to see if there is a cost associated with it. But as you can see on this slide, here is just a very short list of some of those medications that are now $0 for Connector Care members. So certainly folks should check with their health insurance carriers. Now you may be wondering, okay, if you are a member and you have coverage through us and you're thinking, well, perhaps I could save some money. How do I compare my options? How do I know if I'm still able to see the physicians that I want to see, go to the hospitals I want to go to, or even get the medications that I need to get? So we have a lot of shopping and comparison tools on our site. So when you're thinking about changing coverage or shopping for coverage, you would want to use these different tools that are available on our site, and think about these things. We would want to think about the monthly premium that you would be paying for your insurance. Also, you would want to be thinking about covered benefits. So these are the services provided by the plans. Also, out-of-pocket costs. So in addition to the monthly premium, these are amounts that people pay for each service. So for example, what you would be paying for medication when you picked it up, or what you might be paying your copay, for example, if you went to see a specialist. Now, when I talk about a network, I'm referring to the group of doctors, hospitals, and any other facility that you might get service at. Now, to make things a bit easier for you, and Melissa will show this to you at the end of our slides here, we've developed a page on our website at mahealthconnector.org/renew. And this is a really helpful page for members, even if you aren't a member yet. You can go to this page and actually find a variety of tools right from that page, so you don't have to go searching for these tools. They're all there. Now, if you have shopped for your plan, you've made decisions, you might want to be thinking about, okay, what can I do about my payments? How can I make this easier for myself? So in terms of being enrolled in a plan, enrollment is actually not complete until your premium payment has been received and processed. So if you're looking for coverage for January 1, you need to enroll in and pay for that by December 23rd. We are going to send a bill for January coverage during the first week in December. So if you are already a member, you should have seen this bill by this point. And this bill and the amount that's on it is based on your final program eligibility. Now, if you're an existing member and you switch plans and you want to see those changes reflected in December, you should have shopped for that plan by November 23rd. But no fear, you still have time if you want to switch plans particularly if you get a bill for a premium that you weren't expecting, you still have until December 23rd to update your application. Shop for a lower cost plan and enroll in that for January 1 coverage. When you're in the system, I want to just explain that as you're going through, you have the ability to make a payment right through your online application. Now, really important, payments can only be taken from a checking or a savings account. So regardless of how you pay, those are the only ways that you can make payments. Now, there are two types of bills that I'm going to show you. This one is an initial bill. So this is if you have just enrolled in a health insurance plan or just switched plans, you're going to see a bill. It explains that this is for your January 2023 health insurance plan through the Health Connector, and that after your payment's received, we're going to send you a letter confirming enrollment. The insurance plan will also send more information, and this bill is for new coverage. So it's really encouraging you to pay the amount due by December 23rd. And reminding you, if you don't pay the bill by that date, you're not going to have coverage starting on January 1. Now, if you are a member and you have been enrolled in a health insurance plan, you're going to get what we call an ongoing bill. So what does this mean? This is just the regular bill that you get as a member. And what happens is you will see on the left-hand side of this bill, you'll see your monthly premium. You will see any advanced premium tax credits that you qualify for. And then you'll see the balance, whatever it is that you owe, what should be paid in order for you to continue your enrollment in this plan. So in this case, this person has a payment of $2.32. And also this messaging is a little different. This messaging is telling them if they don't want coverage for December, please call by this date. So again, reminders about open enrollment, different messaging depending on whether or not you are a person who is a current member or you're newly enrolled. Also important to note is that on all of these bills, you will see the carrier or the insurer that you're enrolled with, plus the name of the health insurance plan. There's also other important information like your member ID, etc. So do become familiar with these bills. There is a lot of important information on them. So here, I just want to go over some things related to payment. So if you are an existing member and you're changing health insurance coverage, and changing health insurance carriers, you are going to receive a quote. So it looks like that initial bill, and that's going to reflect the new carrier that you chose. And again, you need to submit payment to start that coverage in this new plan. Also important, you're going to keep the same member ID even if you select a new carrier. And really important is that if you're staying in the same plan, please check to see if any premium changes. If the amount has gone up or gone down, you want to pay that new premium by December 23rd. Now, we've talked about payment for coverage starting on January 1. We know that's due on December 23rd. Then each month going forward, you're going to need to make payments by the 23rd in order to stay current in your health insurance plan. Now, payments can be made one of four ways. The fastest is to make them online through the payment center. You can also send payment by mail. You can new within the last couple of years, make a payment over the phone, or you can walk into one of our walk-in centers. If you choose to walk in, I would suggest to take a look at the Health Connector's website, look at the centers that are available for you and hours of operation. In case anyone makes that effort, we do not want you to be disappointed if they are not open. Now, if you want more information on how to make a payment, we have a page on our website or several pages actually, specifically outlining all of this information for you. Now, you might be wondering if you wanted to set up an auto payment. So if this is something you wanted to do so that you don't have to think about making a monthly premium payment, that is something that you can choose to establish. So there are a couple of different options for members if they choose to set up an auto pay. So, and have the monthly premiums withdrawn automatically each month. So you don't have to worry about, paying this bill. Instead, it's just being withdrawn from your checking or your savings. Now, if you choose to do that, you're going to be asked whether or not you want to have your premium amount withdrawn, whether you want your current amount withdrawn, or if you want a custom amount withdrawn. So I want to explain the differences between those three. So your premium amount is simply, as it states, whatever that premium is. So if your eligibility changes and that premium goes up, or your eligibility changes and your premium goes down, whatever amount is due is going to be withdrawn from your account. Now, current amount is something that's a little different too. So current amount is whatever it is that you owe. So let's say, for example, that you're paying $250 for your premium, and then you made a partial payment at some point. You walked in and paid $50 because you had this extra money and you're like, you know what, I want to apply this to my health insurance because I have it right now. Then when auto pay runs, it's going to take not $250, but it will take $200. So whatever is currently owed, it will withdraw. Now, a custom amount is slightly different. Custom amount is if you, as a customer, decide, you know what, I know that my bill is $251.80. I would like $252 a month withdrawn. I don't know exactly why somebody would do that, but let's just say whatever dollar amount you set, that is going to be the amount that gets withdrawn. Now, very important, if a member selects premium amount or current amount, that means the amount that you that gets charged or withdrawn can change if what you owe increases or decreases. And again, that's going to be something that you really do need to keep in mind. Now, if you, like I said before, if you chose a custom amount, that amount of money is never going to change. It's going to stay the same regardless of the premium that's due. So for example, if the premium decreases, the member will still be charged the prior higher amount and will have a credit on their account. So you really need to think about what is best. Now, you might be wondering, okay, is this a safe thing for me to do? Do I want to do this? Like, give me some more information. So in an effort to make things easier for you, after you've set up auto pay is going to stay with you, and it's going to move to any new plan if you change your plan during open enrollment. And this will be applicable all year long. Now, if you set up auto pay and then you lose coverage and then come back to coverage, your auto pay will reactivate. And when you set up auto pay, an email address is required. And because we really need this, because we're withdrawing money from your account, you cannot unsubscribe from getting emails from us. So we send a message 5 days confirming that the auto pay is being withdrawn. So you will always get that message. That is not anything that you can unsubscribe from, because we want you to be aware that that money is coming out of your account. Now, very important, if your member premium increases by 50% or more, less than 5 days before auto pay is charged, the Health Connector is going to call you to let you know and to make sure whether or not you want to keep your auto pay set up. Now, if we can't reach you as a member on 2 attempts, the auto pay is going to be turned off. And again, this is just really important, and it's to protect you as a customer so that you don't have an unexpected withdrawal coming out of your account. So I mentioned some of this, but I just want to make sure I reiterate this as it relates to payment. So we send a bill each month, even if a member's on auto pay, and the amount that we'll be charging is on that bill. So if your premium changes, we send a revised bill the next day, and that amount will be charged is on it. We also send an email 5 days before we charge the member account, and we indicate the amount that's in it, as we said. So the email has a date and the amount that's going to be charged included in it. And if somebody selects paperless billing instead of paper in the mail, the member is going to get an email telling them that their bill is available to view. But really important for privacy purposes, you have to log into the member portal to see it. So we do not include details of the transaction in the email. You need to go to the portal, which is more secure, so you can see that information. Now, if you want to make any changes after you've set up autopay, you can certainly do that. You can cancel, you can update autopay, you can do all these things through the member portal. There's lots of other things you can do through the member portal. So we really do encourage members to go there and check out the variety of notices, tax documents, etc., that are available to you. If you, for whatever reason, want to change autopay, you can also call our member service, our customer service center, and they can help you change the autopay. Now, if you want to get some help, so I covered quite a bit here. We talked about open enrollment. We talked about changing coverage. We talked about a variety of tools. Want to let you know that there is free help available to you. We have a customer service center, and throughout Massachusetts, we have community partner organizations. So the number for our customer service center is 877-623-6765. And you can go to our website and you can follow the link and review our customer service center phone numbers, details, etc., hours of operation. We also have help from these community partner organizations, and these are people who are trained and certified for application support. Now, many people speak languages other than English, and they can help answer questions about your eligibility. They're there to talk to you about any aspect of this health insurance process. Now, because we're in open enrollment season, we really recommend that you call ahead to schedule an appointment. And if you've never worked with a navigator or a certified application counsel before, and you want to find someone to get to help you, you can go to our website. You can find a location that's close to you, and you can set up an appointment. You do not necessarily need to see somebody in person. They can help you over the phone. They can even help you over Zoom if you prefer. So think about that and see what will be best for you. I mentioned customer service, but I also want to be specific and share information about their hours of operation, and with a special focus on open enrollment. So you can see that during open enrollment, we are open Monday through Friday from 8 a.m. to 6 p.m. We have some extended weekend hours on particular days as we get close to the payment deadlines. So December 22nd, December 23rd, January 20th, and January 23rd. And then we also have special weekend hours on December 17th, January 21st, and January 22nd. So if you do need support and you're trying to reach our call center, please be aware of these additional hours that were available during open enrollment. So I have shared quite a bit. I want to give my colleague Melissa an opportunity to jump in and do some demos for us.
As Nikki had mentioned in her presentation, this this renewal page, it's actually the mahealthconnector.org/renew. This page basically gives you information and tools for members and non-members to help you decide whether or not you made the best decision, or basically what you need to do just to empower yourself on the decision that you're making. So I just scrolled down on the screen here, and these are the various tools and resources that you would need. And the first one is review your 2023 eligibility and plan, compare changes for 2023, check providers and prescriptions, shop during open enrollment, and ways that you can pay, and some information regarding payment. So the first one that I wanted to go through and show you is the check providers and prescriptions. So I'm just going to click on here, on the link here, go to our plan provider tool. So this tool can help you see what providers and prescription drugs are covered by the health and dental plans available to you through the Massachusetts Health Connector. So if you want to click on continue. So here we just have to answer a few questions regarding your health insurance plan. So for the first question, you want to enter your zip code, and I already have a zip code here. And then number 2, do you qualify for the connector care? I'm going to say, I'm not sure if I do. I'm new to this, just trying to figure this out. So then question number 3 would be, how many people are in your household? So I'm just going to say 2 people, and I'm going to pretend that it's a couple, just a married couple. And what is your household's expected income in 2023? So I'm just going to say it's 53,000. Again, I'm just using this as an example. And then once I enter all this information, I just want to click on continue. All right, so now we want to do a provider search. So we want to enter the name of each doctor or other provider. So I'm just going to say it's Dr. Patel. And then when you enter Dr. Patel's name, you have a selection of providers that you can choose from. So I will just select this one here. And we get some more information regarding Dr. Patel. He's a physician assistant, so that's fine. And we want to continue. And then we want to type in each facility name. So I'm going to say Brigham and Women's Hospital. We get 2 options here, and I'm just going to click on hospital. And then we continue. And then you want to type in each prescription drugs that you want to figure out whether they're in network or not. So again, I'm just using this as an example. So I'm going to say Ativan, and one thing that I want to point out as well. So you get a selection here, you get options that you can choose from. You want to make sure you select whether or not it's injectable or oral, and you want to make sure you know the dosage form and the strength. So you want to provide as much information as possible. So then I'm going to click on compare plans. And then here we see that there's 3 plans available for all the information that we had put in for the provider, the facility, and the drug. So the first one that we have here is the Mass General Brigham Health Plan, Connector Care 3. So we see for the prescription, there is one. Actually, we see here that it is not in the plan. And we don't see the provider listed, so that means that the provider is also not in network. But we see here that the facility is in fact in network. So, and then we have Tufts, Health Direct, and then the WellSense Connector Care Plan 3. So the same thing, we just scroll along to check whether or not each of the drug, the provider, or the facility. And I see here that unfortunately, I don't see those options for these other 2 plans here. So based on the information that you put, you want to make a decision on whether or not you want to select a plan that has all of the information that you need, that you want to make sure is in network with the carrier that you select. So that is really great. So let me just go back to the renew page. I'm just going to click out of here. So now that we went on that page, I also wanted to show you the shop during open enrollment. So on this page, you can compare health plans online. So I'm just going to click on this link, signing into your account. So this is our home page, and this is where you would have to go on to basically sign into your account and get into your application. So I just wanted to point out two things on this page. On the top of the page, well, on the top here, you see apply now, and that takes you directly into the application. But before you go in there, I just wanted to point out, you have an option to sign in. And if you don't have an account with us, you're not a member with us, you want to scroll down and then you want to click on create an account. And you would actually have to put in an email address and create a password. And from there, you will be able to create an account and go into the application. And then here's just helpful tools to see what you may qualify for. And then this is just welcoming you to the Health Connector, some information here, the get assistance, or go to mahealthconnector.org/help center. And that's really important to see. And also you can preview plans. So this is also a really great tool for you to have just to go in. So I'm going to close out of there. And then I am going to show you, so on this one here, I'm going to click on that link. So basically here, it just tells you that there are 4 ways that you can make your payments. You can go either online, you can pay by phone, you can pay in person, or you can pay by mail. So the quickest and easiest way to make a payment to the Health Connector is online. And the way that you can do that is by signing in through your existing account. When you sign in, you can update your application, contact preferences, and make payments. And that was basically the page that I had showed you previously. But you can also actually click on this link here, sign in to make a payment, and you can go directly into your account, or you can make a guest payment. You just want to make sure that you use the forms of payment that we currently accept, which is the checking or savings account. And I just wanted to also note that forms of payment that we do not accept at this time are credit card, debit card, or other online electronic payment methods such as PayPal. So also another thing to keep in mind, I'm just scrolling down on the page. So your enrollment is not complete until you make your first payment. You definitely want to make sure of that. So here we have some due dates that are very important. So let's just say that, you know, we're in December, as we are now, it's December 14th. You want to enroll with us, you come onto the page, you complete the application, you pick your plan, but now you want to make sure that you make your first payment. And all of our payments are due on the 23rd of each month. So if I made my first payment in December, it would be due by December 23rd. And your coverage would start on the 1st of the following month. So if I made my payment on December 23rd, your coverage would start on January 1st. So this is just really important to keep in mind. Nikki had also mentioned in the presentation that you can also sign up for auto pay. It's a great feature that we have, and you can also select types of payment you can make with the auto pay selection. So that's really great.
Thank you for going through that. We hope you found that helpful. And we have some time left, hoping we can answer some questions that people have.
So we do have a few questions. Thank you so much for going through all of that. I know you mentioned that individuals do have access to dental coverage through the Health Connector. Is that something that should be signed up for at the same time as health insurance coverage, or is it treated differently?
Yep, no, thank you so much. So dental coverage actually is treated a little bit differently. But to make it more convenient for you, if you are applying for and enrolling in health insurance coverage, you can enroll in dental at the same time. So first time you're going through, you'll be able to enroll in dental coverage at the same time you're picking your health insurance plan. Now, if you wanted to enroll in dental coverage in a couple of months, dental coverage is one of those things that we don't have an open or closed enrollment period for dental coverage. So if that's something that you chose to enroll in later, you would just need to call our customer service center and add it onto your account. Just want people to be mindful that certain dental procedures require a waiting period. So if someone is thinking about enrolling in dental coverage because they have an upcoming thing that they want some help paying for, just be mindful of that and, look into that dental plan a little bit more closely, and you can even call them to ask them some more information.
Great, thank you so much. And I think on that same note, I know, Melissa, you provided a great demo of the provider search tool to see if the plans you might be interested in or plans that you might currently have cover prescription medications or your providers. How can you know for sure if the plan you select covers your preferred providers, your preferred hospitals, et cetera? Are there any other things that an individual should do?
So one of the things that I tell my members to do is if you want to be 100% sure, you would just call the number in the back of your card and just ask if that plan is a network.
Great, thank you. So kind of the tool is a great resource for individuals as they're going through the process, but it's always better to double check with the provider is kind of what I'm hearing, just to make sure. Excellent. The next question we have, what if a person was previously enrolled through the Health Connector? Say they got a job that offered them insurance and for whatever reason, they canceled their Health Connector coverage, and then for whatever reason, they are now in need of health insurance coverage again. Should they kind of go back and start from scratch, or what should they do next?
That's a great question, Erin. And if anybody, if this is anyone watching this is in that situation, you absolutely do not need to start over. You would just need your username and password and log into the online application. If you've forgotten your password, you can also, retrieve that password. What you really want to do is not create another account. You don't want to create a duplicate account because that will just cause you difficulty, but rather go in, find your old account, and then just make the changes to reflect whatever is newly going on with you. So if you are no longer employed by that company, you no longer have that job, are you collecting unemployment insurance? Are you collecting some pay from that? You just want to update all the relevant information, but whatever stays the same can stay the same. So you do not need to start over.
Great. And so you mentioned you can retrieve your password if needed. Is the contact center someone that they can reach out to if they need login assistance as well?
Yep, that's actually a great point. If you need help, a lot of people apply for coverage. They may not necessarily have applied online themselves. So sometimes people even someone else has submitted an application for them. So if you've gotten help at a hospital or a health center and someone submitted an application on your behalf, you can call our customer service center and you can ask them to send you a link to your account. And then you'd be able to go into that account. Or you can call customer service and you can ask them to help you get into your account and make changes. So, we know everyone kind of has a different level of confidence with online applications, computers, different level of access to technology. So please don't hesitate. There are people on the other end waiting to help you.
Fantastic, thank you. And you mentioned, updating your application, keeping it current if your income changes. Income can be tough, especially as we talk about projecting or doing a best estimate. For somebody who maybe is unemployed, what income should they count? And then if you're not sure what your salary might be for 2023, maybe you're actively looking for a job, but you don't know if you're going to get a job. You don't know what kind of job that might pay, or what that job might pay. How do you estimate it? So how do you factor unemployment, and what do you do if you're just doing your best to guess?
Melissa, do you want to take this one? Because I think you explained this really well.
Sure. What I try to tell everyone is just to give the best guess the best guesstimate that they have. I also tell people just feel really comfortable always going on the application and updating as you go. So for example, if maybe at one point in time you're receiving unemployment, you want to put in the amount of the unemployment you're receiving. But then if your unemployment stops and you're no longer working or you found another job, you want to go into your application and just notify us of that. That way, we're able to give you the best eligibility for your current situation.
Great. And so the system does all the work behind the scenes as long as the individual updates it with the correct information as their circumstances change.
Yes, exactly. Yes.
Great. And then, there's a lot of, factors, maybe streams of income. If somebody's receiving child support, how do you factor that into counting of income?
So when you're entering income, we get a lot of questions about what somebody needs to include or not include. But child support is one of those things that isn't counted. But if you are receiving alimony, that is something that does need to be counted. So we think the safest thing to tell people is to go to our website. If you go to mahealthconnector.org, there should be a link readily available to get started and get some help with starting your application, and look to see what income types are you should be including, and what income types you can be excluded. I think that's the easiest and most accurate. That is the most accurate list of what somebody should include or not include. Melissa, is there any other advice you would give someone?
Yeah, if you are uncertain at any time, there are little small links in the application. If you click on there, it will describe exactly what you need at whatever point you are in the application. So that way, if you have any questions, you can click on the links that we provide in the application to further explain exactly what is required.
And Melissa,
Great.
when you're in the application, it's like a little eye, right? It's just like a little information icon.
Yes, and it's right next to wherever you're at. Like, so for example, if you're in the income portion section, you just click on the eye and it will give you the information that you need.
Great, excellent. And I did include in the webinar chat on the side, just the link for how do I answer questions about income, which might be a good start for some folks. But again, our contact center, local navigators can assist with these questions as well if you're very, need some additional assistance. So just one more question before we wrap up here. We're in open enrollment and the important December 23rd payment deadline is approaching. So individuals need to select their plan. And if they have a premium payment, make that payment by December 23rd for January 1st coverage. What happens if they miss that December 23rd deadline?
So if someone misses the December 23rd deadline, they will not be able to enroll in Health Connector coverage beginning January 1st. So we cannot stress enough, if you need coverage for the start of the new year, you want coverage for the start of the new year, you should act now, do your comparison, make an appointment. People are still available to help you. Just get everything submitted in advance, payment included if one is owed by December 23rd. Now, if you miss that deadline, their open enrollment actually continues on into January, but that is for coverage that begins on February 1. So again, we don't want to discourage anyone. If you are in a situation, you find yourself on January 28th saying, oh my gosh, I need to do this, do it, apply. I think I mentioned at some point in the application that we share this application, or this is an application that both the Health Connector and Mass Health uses. So sometimes as you're going through the process, you may find people find that they're not eligible for Health Connector coverage, but instead they do qualify for Mass Health. Mass Health coverage does not begin on the first day of each month. They have different rules and different flexibility. So if you need health insurance coverage, simply apply. That's my message. Melissa, what would your message be?
No, that's a great message. I think that's perfect. Yes, you need insurance, apply, and always remember 23rd of each month is the due date.
And I guess one last question that I'll ask, just because as you were speaking, responding to that, I kind of developed another question. Say you're starting the application on your own and all of a sudden you realize, I just don't know what to do next. Did you just waste your time, or what should you do next?
So the great news about that is, no, you did not waste your time. The application will save everything for you, so you can, log off, log back in, continue where you left off.
And if you get stuck and you don't want to go back, you can call our customer service center, or you can even make an appointment with a navigator or another assister in your area. And if you give them permission, they can get into your application wherever you had left off, and they can help you get across the finish line. So again, we're here to encourage you to complete the application, get into health insurance coverage, and seek the support if you need it.
Excellent. And we actually just had one final question come in that I'm going to try and get in under the wire. If somebody is eligible for coverage through like a spouse or a partner's employer, but they feel that it's expensive, especially, given different circumstances, are they eligible for coverage through the connector, or what would you recommend?
I would recommend still completing the application. If you feel that the insurance is really expensive, I would enter all your information into our system. You're going to need to get some more detailed information about the coverage from your partner's employer. Enter that information. What our system will do is calculate some things on the back end to see whether or not you actually could qualify for coverage through us and get some savings. But typically, if somebody is receiving access to insurance, even from someone else's employer-sponsored insurance, you won't be able to get savings through the Health Connector. But it is worth going through the process if you feel like it's just doesn't seem affordable. You may be able to get some help through us.
Great. So don't rule it out, because if it is unaffordable, then you may be able to get financial help through the Health Connector. So definitely take a look. Yep. Well, thank you so much, Nikki and Melissa. That was incredibly helpful. And I know from our attendees' point of view, very helpful with their questions. So I am just going to pull up the poll that we mentioned earlier in the at the opening of the presentation. Please remember there are 3 questions with some choices that you may have to scroll down. If you could please complete this little brief questionnaire to help us as we create our content for the upcoming year. These are monthly webinars. You're always welcome back. Content might change slightly. So if you found this helpful, please let your friends, family members who might need health insurance coverage know. And if you can complete this questionnaire, then that will be helpful as we develop next year's webinars. But thank you again for joining. Remember, December 23rd is the date to complete an application and select a health plan and make a payment for enrollment for January 1st coverage. Nikki, Melissa, anything else you'd like to add?
Apply mahealthconnector.org, and you'll find all the other information you need that we stepped through today. It will all be there. Thank you.
Thank you.
And I'll leave this poll up just so people can complete it. Thank you.